For those who don't know me, I'm Dr. Julianne Flynn, the Chief of Staff at South Texas Veterans Healthcare System. Well, what a year 2020 has been so far. I want to extend my kudos to all of the clinical staff for your flexibility these past months. You helped guide the entire organization to provide exceptional care for our COVID-19 patients, while still maintaining outreach and offering as much routine care as you could safely provide. Thank you for all you've done these past months. The speed with which you switched to virtual care also amazed me, and some really innovative solutions came up along the way. All of these efforts led to our being a leader in telehealth, with 98% of our mental health, 83% of primary care, and 59% of specialty care providers doing at least one CVT visit to the home this year. Kudos to you. That made South Texas the 4th highest in the nation for VVC volume in a facility. Way to go. It's also exciting to see so many services Phase 3 transition plans approved to assure any medical needs our veterans may have been neglecting during COVID are addressed now. I'm confident that the approaches you all developed this spring and summer will assure outstanding clinical care continues throughout the next months of the pandemic. I confess I've worried about our veterans ignoring their chronic medical conditions during this COVID time we're in, and I want to make sure that all that routine care is maintained so that our veterans don't suffer any unneeded complications, whether it's related to COVID or related just to their chronic medical conditions. So I'm so pleased with all you've done to develop approaches for this new normal we're in, and to assure that timely care is delivered 100% of the time for all of our veterans. I also want to give a shout out to our whole health team for all of their fine work with veterans and staff. We all know the importance of integrated care, and amazingly, despite supporting the labor pool and adjusting to virtual whole health care, they increased the percentage unique seen by 58% this year. And their work done to focus on mindfulness and balance has been key to burnout prevention efforts and improved quality of life for our patients and our employees as well. Finally, I just want to say thank you all for all you do for our veterans and for each other each and every day.
It could not be more timely that the World Health Organization designated 2020 as the International Year of the Nurse. The courageous work of nurses and other healthcare workers in the face of the coronavirus has not gone unnoticed. As an employee of one of the most complex VAs in the country, you served our veterans honorably by generating creative ideas, focusing on patient safety, and you really displayed a level of commitment that cannot be matched. Thank you. With that said, we must continue to be resilient and support ongoing continuous readiness. We're due for an unannounced Joint Commission survey. Are you ready? The survey is a real-time assessment of how we effectively and safely manage the care of our veterans. I encourage you to be proactive and, of course, assess your areas to ensure compliance. Don't forget to review the National Patient Safety Goals, your ongoing performance improvement efforts, and Joint Commission standards that apply to your specific area or role. The key to our success is to be well prepared, engaged, and of course proactive. With preparation and knowledge, we can make the next Joint Commission site visit a positive event.